reading medical papers. The title of this article is Effects of Chronic Remote Ischemic Conditioning on Atrial Fibrillation Burden in Patients with Permanent Pacemakers. Hello, everyone. Today, I want to share an interesting medical study with you. Did you know that atrial fibrillation, commonly known as an irregular heartbeat, is the most common heart rhythm disorder worldwide? It not only causes symptoms like palpitations, dizziness, and heart fluttering, but also significantly increases the risk of stroke and death. So, is there a simple way to reduce atrial fibrillation without medication or surgery? The answer is yes. This method is called remote ischemic conditioning, or RIC for short. What exactly is RIC? It sounds technical, but it's actually quite simple. You use a blood pressure cuff on your arm, inflate it to 20 millimeters of mercury above your systolic blood pressure, and hold it for 5 minutes before deflating it. This cycle of inflating and deflating temporarily restricts blood flow to the arm, causing brief ischemia, then restoring it. Although the arm experiences mild stress, this process triggers a protective response in the body that benefits the heart. This is what we call remote ischemic conditioning, creating short-term ischemia in one part of the body to protect another organ. How was the study conducted? At Zhongda Hospital in Nanjing, 66 patients with permanent pacemakers participated. Half of them performed RIC twice daily for 12 weeks, while the other half received standard follow-up without RIC. In the end, 61 patients completed the study. What were the results? In the RIC group, the burden of atrial fibrillation began to decrease after 4 weeks. By 12 weeks, it dropped significantly, from an average of 17% down to 8.6%, nearly cutting it in half. The frequency and duration of atrial fibrillation episodes also noticeably shortened. In the control group, the burden of atrial fibrillation remained almost unchanged, staying at the original level. In other words, this simple inflate and deflate method truly helps reduce atrial fibrillation. Why is this important? Atrial fibrillation is not just an irregular heartbeat. It causes blood to circulate abnormally within the heart, increasing the risk of blood clots and consequently stroke. Studies show that the higher the burden of atrial fibrillation, the greater the risk of stroke and cardiovascular events. Therefore, if the RIC method can reduce the burden of atrial fibrillation, it could theoretically lower the risk of stroke and heart disease. Advantages of RIC. Simple. Only requires a blood pressure monitor. Safe. Patients in the study tolerated it well with no serious side effects. Affordable. No need for expensive medications or surgery. Potentially long-lasting. Effects can last for several months. Points to note. Of course, this is only preliminary research with a small sample size. Larger and longer-term clinical trials are needed to confirm these findings. In summary, this study suggests that a simple inflate and deflate technique, chronic cardiac preconditioning via RIC, may help reduce the burden of atrial fibrillation, thereby lowering the risk of stroke and heart disease. Although more research is needed to verify this, it represents a promising non-drug treatment approach. In the future, we might be able to exercise our hearts and protect heart health simply by using a blood pressure monitor at home. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.